My colleague in the cabinet, Dr. Amperine Lingdo, our Honorable Minister for Health and Family Welfare, our respected Chief Secretary, Shri D.P. Watlang, all our other officials of the Health Department who are present here on the dais and off the dais, Mr. Khosla, the founder partner of Khosla Venture, Mr. Nilekani, the chairman of Infosys and the founder CEO of Aadhaar, Dr. Nachiket Moore, the public health expert who's present with us on the dais here, Mr. Shrikant, the founding CTO of Aadhaar and the chairman of the 10-bed ICU, our senior vice president of HDFC, Mr. Kaushik, and all the other friends and dignitaries who have joined us here physically, as well as those who are present online, all the doctors, the medical officials, and the nurses, and all my dear friends who are here to be part of this very, very important and a very, very positive and I should say a satisfying moment where we will see a huge change and difference in the way healthcare is being provided at the grassroots level to the people of our state. So I take this opportunity to first of all welcome all of you, and more importantly thank all of the stakeholders who have played a very important role in making this 10-bed ICU project a success. And we have started and we have launched with some of the locations today, and I'm sure that we will be able to complete the other locations very soon. And more importantly, we look forward to ensuring that they are run with optimum utility, and also aspire to ensure that we are able to expand this even further so that we can reach the other nooks and corners of the state and different regions which are inaccessible. Having said that, this is again another step forward in the direction which we had set ourselves to move in about 5.5 years back, when we had taken over in 2018, and the first MDA government. I had clearly mentioned to the cabinet and to all the officials that we will give top priority to our social sectors, and health will be one of the major areas in that aspiration of ours. And I'm happy to inform you that in a matter of 5.5 years, India, in Meghalaya today, has become the #1 state in terms of the percentage that we spend on health in terms of our budget. Meghalaya is the highest. Over 8% of our budget is spent on health care, which, as I said, is the highest in the country today. So this speaks volumes about the kind of dedication and the commitment and the kind of focus that we have towards health, and to ensure that health services are transformed at every single step. And having said that, I have been a very, very firm believer in ensuring that we have to make sure that we utilize our assets and our manpower that is there and the resources that we have in the most efficient and positive manner. And we have realized that while we have a large number of things to be done, while we have many more hospitals and centers to be opened, while we need to ensure that more machines are there, while we need to ensure that more manpower is taken and technology is implemented, we often forget that there is already a lot of things in our hand which we do have. And we sometimes fail to make what we already have productive. And hence, we started off by ensuring that whatever there was already, how do we make things better? How do we ensure that the sub-centers, the PHCs, CHCs, the manpower that we have, how can we make it better and perform better in it? And through the process, I'm happy to see that these kind of very low-hanging fruits, as we call them, small tweaking being done in the system, we were able to really see a drastic improvement in the overall health sector in the state. And one of the numbers that I would like to share with you today is regarding the MMR. And just to give you an idea, that the average in India, the national average was 113 in 2019. This is just 1 year after we had taken over. 113 was the MMR in the country, national average, and Meghalaya was 200 plus. So we were looking at about 200, 220 numbers. So 113 was the national average, and we were 200 plus in terms of MMR. In a matter of 3 years now, at 2022, 2023, Indian national average is still 113, whereas Meghalaya has come down from 220 plus today at 120. And we are very close to touching the national average and hopefully coming below it very soon. And these things have not been done because of huge investments being made on new technology or anything like that, but by ensuring that our team, our officials, our doctors, our nurses, the different kind of services at the grassroots level are provided at the right time. We are able to use simple technologies to map and to monitor our high-risk mothers and be able to intervene at the right time with the right resources and the right manpower. And just by doing simple things like these, we were able to transform and change the sector. And I hope that we will continue to do this and be able to come down below the national average in maybe a couple of years. So this will be a huge achievement, and I must say this credit goes to all of you who is in this room today. Each and every one of you has contributed to making these small differences in our people's lives, which are very, very meaningful. Now, having said that, the health sector as a whole, or the health, I should say, industry as a whole, which I was mentioning earlier when I was speaking to Mr. Kostla, is that the different transformations that have taken place. We saw in the beginning how the manpower, the training, and how medical research led to transformation and change in the overall medical sector, in the history of medical sector. Then we saw how medicine started playing a very important role. So the innovation that took place in medicines led to a transformation or a revolution in the health sector. And then the machines came in. And when the machines came in, it was like a third revolution where we saw the huge change because of important machines like MRI, CT scan, and other machines that came in that transformed the overall health sector. And now the current revolution that is taking place is actually the information technology revolution that is taking place, the AI revolution that's taking place in the health sector. And hence, health sector is going through a huge transformation as we speak today. And we saw a glimpse of what that can do. And technology is going to play a very, very vital role, especially in providing health services, and especially in regions like ours, which is very, very disconnected and difficult terrain that we have in our state. And therefore, just to give a simple idea to you, that apart from what we're doing in care, the technology that you've seen, I think some of you understand the depth of that technology, but we want to go further into that and be able to micromanage details of every patient in the state today. And we are moving towards that. And this data and this information, as you know, will allow us to capture the actual scenario that's happening at the grassroots, analyze it, and be able to create predictable models as to what we need to see happening in the days to come. And obviously, AI will play a very crucial role in being able to really implement the data that is there and create those predictable models and allow us to then be able to take policy decisions as to how we should change things and improve things to have a better impact on the overall healthcare sector for our state. So this is a very, very important stage. And what we are seeing that's happening today in terms of the 10-bed ICU that's coming up, some of you might just think that this is just an ICU that's coming up. But this is much more than that. There is a lot more going on beyond what meets the eye. Where, yes, through the telemedicine, we will give the healthcare services. But while we do that, as I said, we are creating a massive database, a massive predictability model, and AI being part of that will allow us now to transform and be able to create a better preventive medication system in the coming days. And that's what really is the most exciting part about what technology is doing in the health sector. And I'm sure that this will have a huge impact in how we do things in the future. While speaking on that, I also want to add that when technology is being implemented, just so that all our listeners and our guests who have joined us, especially Mr. Koshla and Mr. Nilikani, would be happy to know that we have a very, very massive and a strong program for IT in our state. I am handling the IT portfolio myself because it's a very, very important portfolio. And we have just finalized our entire optical fiber network connectivity in the state, down to the block level, down to every PHC and CHC. And we will start implementing this in the next 2 to 3 months. Some already are connected, but most of them are not. And so we will be starting this entire network. And in a phase-wise manner, I expect that in about 12 to 15 months' time, 90% of all our important administrative units and all our important health units will all be on optical fiber. Some of the most distant ones will be the ones that will take time. But in most of the cases, we should be able to do it quite fast. But apart from having that, we have just finalized also our state data center, which we expect that it should be up in the next 12 months' time. So the data center is obviously the cloud that we talk about. So we will be having our own state data center very soon. We already have our ICCC program, where we have the Integrated Command and Control Center, which will be again inaugurated in the next few months. And this is where we will be having our data center. And I'm also happy to inform you that we have already started our discussion to get the submarine cable link directly from Chittagong and coming via Dauki here to our city of Shillong. So once we have that optical fiber and submarine cable connectivity, that will be again a very, very crucial part to the overall IT growth and IT sector programs and policies for the state in the long term. And also to share with you that we already have close to about 5,000-seater IT park, which we have come out with, which is almost 100% occupied. In fact, we have a huge demand for more places, and hence we are going for another 10,000-seater center here in our state. And you'll be happy to know that we have just finalized the IT policy, where we are creating huge incentive for companies to come and set up their base here in Shillong in the IT park. And I'm hopeful that many industry leaders who are here, like Mr. Koshla and Mr. Nilikani, will be also very, very instrumental, and I should say can be of huge importance to the state in terms of even the growth in the IT sector. As you know, we have got huge manpower out here. In fact, a lot of Bangalore and Hyderabad centers are actually manned by people from the Northeast, and a large number of them are actually from Meghalaya. So I hope that this will also be an opportunity to appeal and to connect with the IT sector on how Meghalaya could play a major role in the future, not just in BPO, but even when it comes to areas of artificial intelligence and areas where the medical areas of technology can be implemented. And with us going for a project like this, how can IT and medical sector be combined And Meghalaya can show the way on how jobs can be created in this sector, in both these sectors together. So it's really, as I said, it goes beyond what meets the eye today. You are looking at just the ICU. For me, I see a great future in terms of how we can lead the way to show to the rest of the country on how technology and medicine can go together and how jobs can be created. Like Mr. Nilekani was mentioning, that some jobs may go, but the future in terms of a young population, which can be very adaptive. Other populations are older, so they may not be able to adapt to the kind of change in the global scenario that's taking place. But Meghalaya and India are in the right time, in the right place, and having the right demographic profile to be able to take advantage of this particular situation. And hence, I hope that as we move along, we will see that unfold, and we really look forward to having partners to make this happen. Please remember that the government has its role to play, but government cannot do everything. Government has to create the policy, the ecosystem, and be a facilitator. At the end of the day, it is important stakeholders from the private sector, the community, the public at large, different NGOs, we all have to come together if we really want to make a difference in the lives of the people in our state and in our country. I purposely asked both Mr. Koshla and Mr. Nilekani on what motivates them. And if you saw the connection in the answer and the reply that they gave, what motivates them is the fact that they're able to make a change and a difference in the people's lives. They're able to give back to what the community needs today. And that is what drives them. Mr. Nilekani mentioned that it is about seeing how we can use technology to transform the lives of the people, to make a change, to make things better for the people. And that's really what should motivate each and every one of us. And I end my speech by appealing to all of you that you are doctors, you are nurses, you are medical officials, that small bit of motivation in your heart and in your mind, the small desire to care a bit more for the people or for the patient who's in front of you can make all the difference in that particular patient's life. Yes, technology is important, but if you don't have the right heart, then all the technology doesn't matter. It starts with you, it starts with your heart, it starts with your care for the patients, and the system, the money, the medication, the machine, the technology is there to help and support that desire inside you to able to help the people and serve the people of our state. So with these few words, I once again congratulate all the stakeholders. I really wish you all the best. And as was mentioned by our Chief Secretary, that this is only the beginning. It's not a time to celebrate, though it is a time to celebrate, but it is not really a celebration. The celebration will be every time you're able to save a life. The celebration will be every time you're able to help a patient. That is the true celebration that you should look forward to. And I'm sure that with the teamwork and the effort of each and every one, we will be able to take this project to its logical conclusion, and we'll be able to get the desired results that we are all here to achieve. With these few words, I wish you all the very best, and once again thank Mr. Vinod Koshla, Google, the Hamilton, the eGov, the Karuna Trust, HDFC, and all the other donors who have made this project a possibility. I wish each and every one of you the very best, and may God bless each and every one of you, and may God bless our state of Meghalaya and our nation, India. Kublai Shibun, Mathela, and Jai Hind.